Sawadika. Dear colleagues, I am Associate Professor Rassamee, Chotipanvithayakul. I am a child psychiatrist and an epidemiologist from the Department of Epidemiology and the Research Center for Kids and Youth Development at the Faculty of Medicine, Prince of Songkla University, located in southern Thailand. My presentation today is titled Epidemiology of Deliberate Self-Harm and Prevention Using Positive Psychology Across the Lifespan. It consists of 3 parts. The first part is the epidemiology of deliberate self-harm. The second part is about positive psychology. And the final section focuses on the application of positive psychology interventions across various age groups. This is the human lifespan. I will present the challenges and preventive approaches from infancy through adolescence, adulthood, and the elderly. A good understanding of the nature and scope of self-harm is critical for effective prevention. We have conducted a secondary data analysis of suicide and deliberate self-harm at a tertiary hospital in southern Thailand during 2012 to 2016. This work investigated the reasons for self-harm as well as the methods and places of self-harm. The most common reason for self-harm was conflict with a spouse or a lover, especially among females. Self-harm due to conflicts with parents, children, and friends, as well as depression and financial problems, were also reported in about 10% of cases. And this is similar between males and females. Moreover, medical illness and economic issues were more commonly reported among males than females. The most common method of self-harm was drug overdose among females and poisoning with corrosive agents among males. Other methods, such as hanging and firearm, were more common among males than females. Almost all of them did it at home. When broken down into different age groups, conflict with a significant person was the most common reason for all age groups, except for the elderly, for whom medical illness was the most common reason. Conflicts with parents or children and friends were also more common among the young population and decreased with increasing age. Medical illness, depression, and financial problems were more common among adults aged 40 years and above. For the method and place of self-harm by age groups, drug overdosage and taking corrosive agents were still common across age groups, while other methods, such as hanging, were the most common method used in the elderly group. The self-harm mostly took place at home across all age groups. Our study showed that among all deliberate self-harm, 30% of adolescents and middle-age groups had suicidal intention. The suicidal intention increased with increasing age group, reaching 60% in the 40 to 60 years old and almost 70% in the elderly. In contrast, reattempted suicide was higher among youth and middle-age groups. Our data was conducted in the high-risk group who had already had self-harm, and thus the suicidal ideation was high. When compared to the previous study among 2,232 UK adolescent in general population. 5% of them had self-harm only. 4.8% had suicidal ideation only. 3% had suicidal ideation, self-harm, and suicidal attempts altogether. While our data show drug overdosage and taking corrosive agents were the two most common methods of self-harm, the most common method among UK adolescents was to cut or stab oneself. Overdosing was the second most common way of self-harm, while poisoning and suffocation were the least common. Moreover, this study also reported that childhood trauma was a significant risk factor for self-harm and suicide. The victimized adolescents had a 2.4 times increased risk of suicidal ideation, 2.38 times increased risk of self-harm, and 3.14 times increased risk of suicidal attempt. Based on the first part of my presentation, we have seen that the reasons for any self-harm or suicide stem from suffering from either mental or physical issues or both. And the method or the reason for suicide can be different across age groups, across different settings and gender. Now, move to the second part. I would like to present about positive psychology. In 1998, Professor Martin Seligman proposed and promoted positive psychology when he served as the president of the American Psychological Association. Positive psychology is the science of happiness. It aims to catalyze a shift in psychology from a preoccupation with only repairing the worst aspects of life to also cultivating the best qualities in life. The PERMA model encompasses positive emotions, engagement, positive relationships, meaning, and accomplishment has been extensively researched and proven to enhance happiness and well-being. Suppose you can remember that the most common reasons for self-harm in our southern Thailand setting are relationship problems. Here, positive emotions and positive relationships can be promoted through the PERMA model. This can be a very hopeful and helpful tool for self-harm and suicide prevention. On the right-hand side is an example of a poster I have used to promote the PERMA model to parents and our young population. The information shows activities that can be done to promote positive emotions, engagement, positive relationships, a sense of meaning in life, and accomplishment. For example, showing gratitude can increase positive emotion. Later, Professor Christopher Peterson, a co-founder of positive psychology, with Professor Seligman, proposed the 24 character strengths. It consists of 6 virtues, as shown in the picture. There are a variety of characters that can be promoted in anyone. Similarly, previous studies have shown that it can increase happiness and well-being. The handbook on the right-hand side outlines how to encourage the 24 character strengths in our workshops for university students. And you can tell that we have engaged in the field of positive psychology. Let's move on the final part of my presentation, which will discuss positive psychology interventions conducted across the lifespan in collaboration with our colleagues. I would like to start from the infancy period, which is the age group where mental health risks are overlooked. Previous study showed that even without obvious physical disabilities, 13 to 47% of preterm infants experienced cognitive problems and psychiatric disorders, including issues with sensory motor development and less optimal socio-emotional outcomes. Our randomized control trial conducted in Southwest China among 200 preterm infants demonstrated that a sensory stimulation program improves developmental outcomes. Specifically, this involved 6 months of a 5 integrated sensory stimulation, including tactile, auditory, visual, gustatory, and olfactory senses. This intervention was administered during home feeding, following discharge from the hospital. The comparison group received standard care, which included an educational session on basic care for infants, covering topics such as feeding, developmental milestones, and vaccination. The 5 ISS group showed a significant increase in standard score of social-emotional development. The lower score presented better development, as shown by the dotted line on the slide. Next is the childhood period, during which we observe the paradox of mental health issues and positive resources coexisting. Our previous study among 2,500 Thai primary school students aged 6 to 9 years reported that mental health issues jumped from 18.3% before kindergarten to 41.9% after entering kindergarten. During their exposure to the new world at school, parents reported high concerns of difficulties in learning, being oversensitive and attention deficit, while teachers reported more problems in reading and learning. Most of them still reported moderate to high self-esteem, happiness, and life satisfaction. After measuring the baseline data, as shown in the previous slide, we provided the intervention group with these 3 exercise books to promote self-love, gratitude, kindness, positive growth, and perseverance. The student completed 1 to 2 pages each time, at least twice a week, for 1 semester or 4 months. The control group did the activities provided by the school. Interestingly, the self-esteem and the happiness were not different between the intervention and the control groups. However, the grade point average in the intervention group was statistically higher than that in the control group, as shown in the middle graph. Let's move to the adulthood period. Another previous study among Chinese university students reported 32.1% of adverse childhood experiences. The most common adverse experiences were emotional abuse and emotional neglect, followed by parental divorce. As mentioned before, adverse childhood experiences could heighten mental and physical health problems when they grow up. We conducted a non-inferiority trial of a character strengths-based intervention. During conducting the study, the COVID-19 pandemic attacked the study areas. Therefore, the university students' stress levels were particularly high on top of their baseline mental health issues from adverse childhood experiences. We compared the effects of a character strength-based intervention with those of group counseling, which required an expert psychologist and was more time-consuming. Character strength-based intervention yield similar outcomes, including positive growth and enhanced well-being, but not a reduction in depression. Moreover, it can be conducted among a larger group of university students than group counseling. Finally, the elderly group. The Chinese elderly in our previous study reported that health and family relationships were the most determinants of their subjective well-being. We have not conducted any positive psychology intervention among this age group. However, please note that the PERMA model aligns with their needs to promote positive emotions and positive relationships. In summary, our previous studies have demonstrated the benefits of positive psychology interventions in enhancing happiness and well-being. This, in turn, could counteract conflicts and relationship problems and may prevent self-harm and suicide across the lifespan. Thank you very much for your attention. สวัสดีค่ะ